right, well, welcome to our Mind Plus Neurology Wellness Workshop. This month, Gable's joined us, and we're going to be dissecting a migraine. What is it? Understanding it better, phase by phase. We all know that migraine's not just a headache, and that there's distinct phases that are defined, and we're going to find out more about that. And Gable, you can go ahead and take it away.
All right. So, we probably should start out by defining what a migraine is. So a migraine is a complex neurological disorder. It oftentimes has a genetic component to it. It is characterized by moderate to severe head pain, also associated with sensitivity to light and sound, and or nausea or vomiting. There are some other symptoms that can go along with a migraine, but by definition, the above symptoms, or the ones that I just mentioned, are actually in the definition to be diagnosed with migraine. And so, when someone says they have a migraine, everyone always thinks of severe head pain. And while that is part of a migraine, it is not the only phase of a migraine. There are actually 4 phases, and that's what we're going to talk about today. So we have the prodrome, aura, head pain, and then postdrome. And so people that experience migraine can experience all 4 phases. And if they do, it doesn't mean that they will experience all 4 phases every time that they have a migraine. I guess most prevalent type of migraine is actually migraine without aura. So therefore, a lot of times going through the phases of migraine, you might not, ever experience aura. So you might still have a prodrome, and then you go to head pain and kind of skip over having an aura. All right, so the prodrome. This is the first phase. These are like the earliest signs that the head pain is coming, and it may be difficult to pick up on these subtle symptoms because they can happen, like as we go through them, you'll see, but like nausea. I mean, there's plenty of reasons why you may be nauseated and it not be because a migraine is coming. This is a huge area that they're just starting to focus some research on. Up until now, migraine research has been focused on like the pain aspect and treatment strategies for the pain. But they have since found that looking at the prodrome phase and identifying symptoms can lead to patients treating migraines earlier and maybe actually not even getting to the head pain portion of the migraine. They actually published a study. It's actually in this month's issue of Neurology for Clinical Practice, and they identified prodrome symptoms and realized that if they actually kind of combined the study then using one of the newer abortive medications, and found that if they gave that during the prodrome phase, patients did not develop head pain at like the 24-hour and 48-hour mark. The prodrome symptoms can occur hours to like 24 hours to even 2 days before actual head pain, which also makes it kind of difficult to pick up on these symptoms. But it can be things such as the irritability, yawning when you're not like necessarily tired, increased urination, various food cravings, I feel like more times patients have said, they're craving some salty snacks. Could be nausea. Um, and I put muscle stiffness that tends to come with like neck pain, and it's different neck pain than, the neck pain you have, maybe all the time. It's usually like patients will like say like it's a pinpoint area. They can like point exactly to where this spot of neck pain is. Um, uh, Becoming light sensitive and then even fatigue. The symptoms that I put asterisks by, those have, I guess is what I've found in practice to be more of the common ones that our patients have mentioned. All right. Then we'll go to the next phase, which is aura. So of the people that have migraine, only 30% of them have aura. And then of those that do have aura, the most common aura to have is a visual aura. And like I mentioned earlier, if you do have aura, it does not mean that you will have an aura prior to, every migraine or every head pain episode. So then the aura usually happens like 5 minutes to an hour prior to the start of head pain. Um, and the symptoms that you experience in an aura are reversible. So typically what happens is when they can, in a sense, either go away when head pain starts or when head pain resolves, so do those symptoms. So visual aura. A lot of people will describe this as seeing like flashes of light, seeing stars, zigzags, seeing what looks like a kaleidoscope. Um, what people describe, even though maybe they don't know the words, is they will have a scotoma, which is seeing like a blind spot or a black spot, or a scintillating scotoma, which is in a sense like a sparkly blind spot. And I think I included examples. So I don't know if you can see my mouse, but you can see like the black spot there. So that's the scotoma. And then if you're looking the other picture that has those nice pretty colors there, that's kind of the sparkly version of that. And so, yeah, patients will just, kind of describe those without knowing what they're called. Other sensory aura symptoms that people could have would be numbness, tingling, usually in the face, usually kind of picks one side or the other. And it can go into like your tongue or even like a limb. So like being in like your hand, arm. Speech difficulties, so difficulties getting words out, and then ringing in the ears would be another one. Not mentioned, although I do have a few patients that also will have an olfactory aura, meaning they have a certain smell that they notice prior to head pain. It's usually a distinct smell. For example, one person that I have smells like burning toast, and it's always the same smell. It doesn't change. Another patient has like I want to say more of like a sulfur smell that they have picked up on. And then we get to the head pain or headache portion or phase of the migraine. And this is the phase that everyone, associates with the term migraine. This is where you have the pain. So the pain in a migraine, typically one side of the head, although it can be both. often described as a throbbing or pulsating pain. Having the sensitivity to light and sound, and then the nausea or the vomiting. Oftentimes sensitive to smells. And then having like where your skin, the cutaneous allodynia is having your skin is very sensitive, and you feel pain to stimuli that is not normally painful. So if someone, just like gently touches your arm, that's usually not painful. However, in a migraine, that, you're a little more sensitive, and so that simple, little touch is actually very painful. The pain phase, lasts anywhere from 4 to 72 hours. Um, Obviously, beyond that, then you're in status migraine. And then our final phase of migraine is the postdrome. This is the migraine hangover. And although not everyone experiences the migraine hangover, I think it's more that they don't know that that's what this is, because although there isn't a lot of research done on it either, but when asking patients and kind of looking back over their migraine that they, like recently experienced, they do, in a sense, complain of the symptoms of the hangover. So they do say roughly 80% of migraine sufferers do have the postdrome. So this is once you have that severe pain and it subsides and any of your aura symptoms have resolved, you have, you're exhausted. You may have a mild headache, so still having some head pain. Difficulty concentrating and just not thinking clearly. I always feel like this phase is kind of like your recovery phase. If you kind of think about it, you trained for this marathon, you did your prodrome, you now got through the marathon, and now you need to recover. So this is, a time where you need to rest, you need to hydrate, and try to avoid any of your triggers so that you don't, in a sense, start this process over again. So let's see. So what can we do, or how can you, in a sense, help yourself or help us to help you? If you Obviously, we just went through all the phases, and so if you kind of add that up, starting the prodrome, with or without aura, that's a short part of this. The actual pain, and then the hangover phase. Each migraine, in a sense, can be a 7-day event. If you added that up, that's a long time. So you just spent a week, and then to have that go again. I mean, in a sense, you can spend your whole month in a migraine, just going through all the phases. So if you keep a headache diary, which I know is not easy to do, when you're in pain, you don't want to be writing things down. But it is helpful, and it can help identify patterns. Sometimes it is easier to like look back, as you do have the head pain, maybe you can think, what happened the day before? Was there subtle signs that I just didn't think of? But if we can pick up on those patterns, and then we can, treat early, we might be able to, prevent you even getting to, the pain phase. And so, like I had said in that prodromal study that was published this month, that's what they had found, taking your abortive medications early, so during that prodromal phase, actually then prevented the pain from starting, which is what we want to do. All right. So then the slide is just telling you about, obviously seeing us for your new patient visit, getting the proper diagnosis, and then developing a plan, which can be preventative medications. Doesn't have to be, depending if it's, episodic migraine, and if they're infrequent, maybe that's not appropriate. But typically, everyone needs an abortive medication of some sort. And then if we can help you to, identify the phases of the migraine and how, specific to you and what, you're experiencing, so you know when to take the abortive medications. And then if, the meds aren't working, or, you have found that, coming in and being treated even during that like prodrome phase, we have the urgent care. So where you can, work on, getting hydrated and actually using the abortive meds and maybe not experiencing the severe pain that you've done in the past. So, we have questions, comments?
I have a question. Sorry. It doesn't happen often, but I don't tend to have aura. But when I have the head pain, sometimes I might get ringing in ears when I have the pain. Would that be separate from the aura and just be like a different symptom, or would you call that
So it happens
during
when
the
the
head pain?
okay. Yeah, so aura is usually prior to the head pain, but it can just be a symptom of your migraine.
Yeah. Okay. So I was thinking I would call it separate from the aura.
Yes.
Yeah, I mean, that's an interesting thought though, because a lot of the symptoms have overlapping stages, where you can still have a headache even when you're in that postdrome phase. And maybe it's not as severe, but it's still kind of lingering a little bit
Yes.
for you. So yeah, that's interesting to know, like maybe there isn't quite such like a hard edge distinction for some people. Like it's a noticeable shift, but tough to distinguish sometimes.
Yeah. And even during the, the recovery phase, you might not need your like prescription migraine, medications, but that might be where you're using, more of the over-the-counter medications.
Mhm.
Because still it's pain. It's just not usually, that severe pain has subsided.
I'm just thinking about tips on what to do during a migraine, like during that like active pain phase. And I know like what we hear often is people just having to retreat, into like a dark space, a closed off room, quiet, dark. But the other option, like Gable had mentioned, we do offer headache urgent care for our members who are struggling through that phase and want to attempt to get through that phase quicker. And that we have medications that can help. So if you do want to make an appointment and get seen by Gable or our doctor, Dr. Boobles, our phone number is here on the slide, 888-585-7975, or you can always book an appointment on our website, myplusclinic.com. And that's it. So thank you for joining us. Have a good rest of your day. Bye-bye.